Okay, so first thing I'm going to do is knock on the patient's door and make sure I introduce myself and I ID the right patient. Good morning, my name is Annabelle and I'm a student nurse. Can you state me your name? Claudine? Okay. And I'm here to take care of, to clean your trach. So the first thing I would do would be to check the client and check the need for the suctioning. Okay. What I can do that is I can hear it and I can do the lung, check the lung sounds. After I make sure that the patient needs the suctioning, I'm going to get my supplies ready. My supplies include normal saline, peroxide, brand new suctioning, and a tracheostomy care set. So first I'm going to open all my bottles and I'm going to make sure to check for the date and the time it was open. So what I'm going to have set up here, this is supposed to be my table. So first, oh my gosh, I can't do it, okay. So first I'm going to open the Tracheostomy Care set and make sure that I maintain sterility. Okay. Then I'm going to take contents and dump it. So I'm going to take normal saline and put it on both containers. If it's already been opened, then I have to do a sterile lip, which I dump some water and then I pour it. Okay, so I only put peroxide on one side. Okay. The next thing I'm going to do is right here. It's supposed to be higher, but I have my my basin and I open it. I'm trying to avoid turning my back onto the sterile table. So, first thing I'm going to do is put one glove on one hand. Non-dominant hand. I'm nervous. I'll just put it on any hand right now, but it's supposed to be the non-dominant hand. It's not really. Okay, I'll go. Okay, so. Well, the thing I have to do with this is fix the box. So I'm fixing this. What I want to do is take normal saline. I always want to go around and put some in the box. Now I'm going to put the rest of my gloves on. And I can fix my gloves. Okay. So, this side, did we talk about which side is going to, you said this one is the dominant? Or the working hand was the closest?
That was going to be your working hand. Or your clean hand.
Okay, so my clean hand, my sterile hand will be my right side. So with my sterile hand, I'm going to grab the tube, suctioning, and with my dirty hand, I'm going to take suction. So I'm going to make sure that I attach it.
When you're done.
Okay. And this is my dirty hand, so I'm going to make sure that I take it off the packaging. So I'm going to lubricate it and test the suctioning. So I'm going to go down here and put it in normal saline. Make sure it's working. Okay. So now that it's lubricated, keep my hands off and I go in straight without touching it. I go in, and once I meet resistance, I pull back an inch, and I make sure to put my hand right here and suction, and do it really fast, 8 to 10 seconds. I'm doing the bow and arrow technique. And put it into normal saline. I'm going to give the client a minute to catch their breath, and I'm going to say, can you take a deep breath once again for me? I'm going to suction once again with my hands off. Okay, once I meet resistance, I pull back an inch, and I suction. And again, I'm pulling. Okay. I can do that up to 3 times.
Okay. Oh, seriously.
Okay.
So that was
So if I feel like the client needs to be suctioned, then I can now suction the mouth and clean it, and also suction the nose. And I can just set it down, and now I'm not sterile. What's the next step? Okay, so now what we're gonna do is take off the trach, the inner cannula, and then at this point I'm gonna take off the bandage also, the 4x4. I'm only touching the tip. Okay, and I'm gonna put it into the peroxide normal saline. I'm gonna do this really fast and put on my new sterile gloves.
Do I like go back and forth? Well, you have to. I know, but do I do one like do this on and off? Yeah. Okay. Keep it off.
Oh, I'm not supposed to. You're not supposed to do that, but these gloves suck. So make sure you touch it. So now, note to self: practice gloving. Okay. So now I'm wearing my sterile, so I have to do this really quick. I'm only touching the tip, the inner cannula. Oh, I'm sterile. It's okay. So I'm gonna clean it.
No, I'm done. I'm dirty. Do I take them off or take that off?
Okay. I'm gonna put it back in. Once the inner cannula is in, I am no longer. Oh, I forgot. You have to put it in the. So as I'm put it back in, rinse, rinse, rinse.
So
Next, I am gonna clean the stoma with normal saline.
or rearrange them.
One, swipe, and I
Rearrange
throw
them
it.
when your sterile gloves are on.
I'm no longer sterile.
I don't know how to do
Okay.
it.
So now I'm gonna take the
I can
4x4
touch here.
and clean the external plate.
Oh, like I just did. So this.
So once that's clean, then I'm gonna put the tie.
This is. There has to be a better way for me.
Before I take off the old tie, I'm gonna make sure that the new tie is secure.
Okay.
So I'll just pretend that.
So
I'm gonna put the 4x4
now
with
he's died.
to protect under.
Taking so long.
Now once that's done and the client, like I'm all done with the procedure, I'm gonna make sure that the client, I'm gonna check on the client, check that they're not blue, check, assess for lung sounds, and make sure there's no, I don't hear any more crackles or rails, and that's all. Now I have to clean up. Alright. Done.
Thanks.